Hello. Today, we will take a detailed look at the signs of Narcissistic Personality Disorder, NPD, and discuss the kind of help a psychiatrist or psychotherapist can provide to people who recognize these traits in themselves. Narcissistic Personality Disorder, or NPD, is a persistent style of perceiving oneself and others, characterized by grandiosity, a need for attention, and a lack of empathy. A person with NPD is often convinced of their own uniqueness, requires constant recognition, and reacts painfully to criticism. According to modern diagnostic criteria, the signs include an exaggerated sense of self-importance, fantasies of unlimited success or beauty, and the belief that one is special and can only be understood by other special people. It also involves exploiting others for personal gain, a lack of empathy, a tendency toward envy, and the conviction that others are envious of them. On the neurobiological level, research shows that individuals with NPD have reduced activity in brain areas responsible for empathy and self-reflection. This confirms that NPD is not merely a matter of personality but a clinical disorder that requires professional attention. In everyday life, NPD manifests differently. Men more often display aggressive and exploitative behavior, while women may show emotional manipulation and so-called victim grandiosity. In relationships, this appears as alternating idealization and devaluation of partners. At work, it manifests as intolerance to criticism and a drive to dominate. Now, about psychotherapy. The most effective approach is systematic. The first tool is a self-observation protocol. The patient learns to record a trigger, the resulting emotion, and their reaction, then separate facts from interpretations and form alternative behaviors. This practice helps reduce impulsivity and destructive responses. The second approach is transference-focused psychotherapy, developed by Otto Kernberg. It helps integrate conflicting self-images and perceptions of others, reducing internal chaos and stabilizing relationships. The third approach is cognitive behavioral therapy, CBT, which focuses on cognitive distortions, setting realistic goals, and developing stable interaction skills. The fourth approach is Jungian work with the shadow. The patient becomes aware of repressed vulnerable and aggressive parts of their personality, learns to acknowledge them, and channel their energy constructively. Here is a brief clinical example. A 35-year-old patient complained of conflicts at work and feelings of emptiness. Through self-observation, he recorded, trigger, criticism from a colleague, interpretation, I was humiliated, fact, a correction was made in the report. After a month of regular practice, his aggression decreased, communication improved, and he was able to work collaboratively. Thus, NPD traits can be recognized and addressed. The key condition is self-awareness and willingness to work on oneself. On this channel, you can learn scientifically based methods for free. This helps save on costly consultations while achieving real therapeutic effects. Subscribe, continue practicing, and remember, timely work on yourself can save your life and future. It is important to note that diagnosing NPD always requires a differential approach. Symptoms can overlap with borderline personality disorder, where fear of abandonment predominates, or antisocial personality disorder, characterized by disregard for norms and aggression. It is also necessary to distinguish NPD from bipolar disorder, in which grandiosity and impulsivity appear only during manic phases, not constantly. Only a systematic analysis allows for an accurate diagnosis and selection of the appropriate treatment strategy. From a neurobiological perspective, modern functional MRI studies show that people with NPD have reduced activity in the prefrontal cortex, responsible for self-control and empathy, and in the amygdala, involved in emotional regulation. At the same time, their reaction to threats to self-esteem is heightened, which explains hypersensitivity to criticism and intense emotional outbursts. These findings confirm that NPD is not simply a matter of personality, but a real neurobiological condition. Practical self-help recommendations include safe daily exercises, such as emotion and interpretation diary, record triggers, emotions, and the actual situation to see the difference between fact and subjective interpretation. Freeze frame method, pause before reacting emotionally, take a deep breath, and formulate an alternative response. Empathy exercises, Practice describing another person's feelings without judgment, gradually expanding your capacity for empathy. Shadow work. Safely acknowledge anger, fear, or vulnerability within yourself, and note ways to use these feelings constructively, for example, in creativity or problem solving. Clinical example: a 29-year-old female patient noticed constant conflicts with friends due to feeling misunderstood. She kept a diary of emotions and practiced alternative interpretations. After 2 months, she reacted less irritably to minor remarks, improved her relationships with colleagues and friends, and reduced her anxiety. Action plan for someone suspecting they have NPD. Recognize the problem and track your reactions. Study scientifically based self-help methods and psychotherapy approaches. Seek a qualified psychiatrist or psychotherapist for diagnosis and guidance, if possible. Regularly practice self-observation, cognitive reframing, and empathy exercises. Monitor your progress and adjust strategies based on experience. Remember, lasting personality change is possible but requires patience, honesty with oneself, and systematic work. Every step toward awareness of your reactions and emotions contributes to long-term emotional health, harmonious relationships, and a successful life.